Arizona continues to come to terms with the state Supreme Court's recent decision to uphold a near total ban on abortion that dates back to 1864. Among the many questions, how will the ruling impact access to equitable health care? Joining us now is Dr. Swapna Reddy from ASU's College of Health Solutions. Always a pleasure to see you. Thanks for joining us.
Thanks for having me.
Okay, is that decision by the Supreme Court, is that a public health issue?
It is absolutely a public health issue, and it's an access to care issue. It's a healthcare delivery issue. This ruling that has been upheld from a law that was passed in 1864, right? 1864, we practiced medicine really differently. Who delivered babies was very different. Who was involved in the health of women and women's healthcare, very different. What we know from that law is that healthcare providers, anybody that can aid and abet a woman in receiving an abortion, can be criminalized. And so what we have right now is a real culture of fear, and it's really impacting access to care for women as well.
Impact on those who need an abortion to save their lives.
So it impact on a wide variety of women, right? So yes, if you need an abortion to save your life, even though the ruling says that it's okay to receive an abortion if the life of the woman is in danger. But what we know from other states is that really has not been delivered in a very fair or consistent way, right? And there's lots of medical situations in which an abortion might be necessary, might be protocol, and there's been lots of confusion in other states with similar laws.
I was going to say, it would be difficult, I would imagine, for doctors to figure out where the line is.
Yes, and we're seeing a huge impact on exactly that group of people, physicians, right? So we're seeing a huge group on medical students that are interested in practicing in states with the most restrictive healthcare, with most restrictive abortion laws. We're seeing an impact on folks that want to go into especially OB-GYN, obstetrics gynecology residency training, which is, the most women's health focused residency training. We're seeing an impact on OB-GYNs, practicing OB-GYNs wanting to stay in the states with those restrictive training. And what we know at the end of the day is this will impact access to care for women, and especially women in rural areas and communities of color the most.
And maternal mortality, those issues are there already, are they not?
100%. So we in the United States have the worst rate of maternal mortality amongst every developed nation in the world. And what we know is that Black women and Native women have the highest rates, 2 to 3 times the rates of their white counterparts. In some Native groups, up to 5 times the rates of their white counterparts. And so what we know is when we are going to be reducing the number of folks that want to enter women's health care, that want to continue practicing women's health care, especially in those rural areas, especially in those underserved areas, we're going to worsen maternity care deserts.
What California is announcing, what they want to do over there as far as law and assisting those from Arizona who want to get abortion services there, what do you make of that?
So I think at the end of the day, it is a benefit that Arizona exists geographically in a place where there might be opportunities in nearby states. But I think that oversimplifies the issue, because we're still talking about getting to other states. We're still talking about the cost of it, taking time off of work, possible child care, possible transportation, hotels, insurance coverage, all of these things, right? So I think it's when it's simplified into a conversation that you can just go to a neighboring state, or that you can get services from neighboring states that have different laws, it's much more complicated, again, especially for vulnerable women.
I was going to say, and especially for those rural patients and those patients of color.
Absolutely, absolutely, who already have restricted access, not just to abortion, by the way. This conversation, I think, ends up being hyper-focused often on abortion, but we're talking about a variety of women's healthcare services, and we're talking about, things like pap smears, gynecological conditions, high-risk pregnancy, delivering babies, right? Having safe delivery of babies. So we're talking about a wide variety of services that are impacted, not just abortion, when we discourage especially physicians, nurses, pharmacists, et cetera, from practicing in the state of Arizona.
Indeed, and also from training and graduating in the state. This is where, you're at ASU, you know that where students come from and what they're looking for.
Yes.
Are they going to still come from those places and still look for it here if this law holds up?
So it's a really critical conversation. We know that there's a recent survey of third and fourth year medical students, and 60% of them said that they were uninterested in training in a state with really restrictive abortion laws. We know that there's been an 11% decrease in folks going into OB-GYN in states with the strictest abortion laws. So we've already seen the impact of some of this. We've seen the impact in other states like my home state of Texas, Louisiana, Oklahoma, and we're sure to see the impact of this in Arizona as well.
Regarding medical abortion, the medication factor, how does that go into this?
Well, the medication abortion is also illegal under this particular law, and so I think again we have to consider not just the impact on abortion itself, but the impact on the fear factor, the misinformation factor, kind of the chaos this creates, not just for physicians, nurses, pharmacists, hospitals, risk managers at hospitals. Everybody that touches kind of these potential patients are now at sort of this fear level. Am I going to be criminalized for this behavior, whether it's an intentional abortion or any other care that could be falling under that category?
Even with the governor saying it's not going to happen, the attorney general saying, governor putting the attorney general in charge as far as enforcement is concerned, and the attorney general saying, I'm not enforcing any of this, that fear factor still exists.
The fear factor still exists because the narrative still exists, right? And so we're still trying to figure out some of the enforceability piece, especially with the county attorneys, what they might be able to do. But in the midst of all of that, regardless of what actually is legal, what is not legal, what will be enforced, what won't be enforced, that fear factor exists, that discouragement of medical students to want to go into these really critical fields that are already underserved, people wanting to come and train in Arizona, people wanting to practice in Arizona, that damage is already beginning. And we've seen that damage in other similar states with similar laws. And so we're already a place where we need more physicians, we need more providers, and we definitely need providers for our rural communities. We cannot afford to make to take these chances.
And you touched on this earlier. I want you to expound a little bit. Last question here. Just reproductive health care in general, in toto. Yes. How is it affected by this kind of thing? And again, I think most people believe that the 64 law, the 1864, something's going to happen there. We don't know what's going to happen, but most people believe something's going to happen there. But until it happens, it's there, and reproductive health services are affected how?
Yeah, it's there. It's going to go into effect in the upcoming months, right? Again, the impact on the fear factor already exists. The impact on folks wanting to come and practice in this state, train in this state, receive comprehensive training in this state, by the way.
Research?
Yeah, research, absolutely. And also, what's really critical here is not just from the abortion care, but from this wide variety of women's health services will absolutely be impacted. If we do not have enough providers, many of those services we will not have care for. And then also kind of what is the quality of care and how will that impact, once again, those folks that are the most impacted, our rural communities, our communities of color, our Native communities.
Dr. Swapna Reddy, ASU College of Health Solutions. Good to have you here. Thanks for joining us.
Thanks for having me.